Now, with that in mind, I'm going to turn it over to some people from Idaho who are going to be seeing what this means exactly for them. We have Melissa Wintrow, who's the Idaho State Senate Minority Leader, who has joined me today. Idaho, as I said, is going to be getting their notices next week. Some people are already reviewing it. So, Melissa, thank you for joining me. Please tell me about what you are seeing.
Thank you, Senator Murray, and to everyone on the conference today. I'm sorry I'm outside, but we had an emergency alarm going off inside the Capitol, so hopefully you can hear me. But I am so deeply grateful for our time together today. Thank you, Senator Murray. I am the Senate Minority Leader. I'm the District 19 representative in Boise. I'm on the Senate Health and Welfare Committee, so I'm pretty familiar with these issues. And I can tell you I am overwhelmed with calls from people all over the state who are frustrated and afraid about the things that are happening in their health care. Farmers in the Magic Valley, teachers in Sandpoint, small business owners here in Boise, their stories are remarkably similar. They're worried, they're frustrated, and they're asking, why aren't the people we send to Washington helping us? In less than a week, as you said, we'll have open enrollment, and the threats of these increases are serious and skyrocketing the premiums. And that's because of what Donald Trump and the congressional Republicans have done in shutting down the government rather than working with our Democrats like you to extend the Affordable Care Act premium tax credits. And those are the same credits that make coverage affordable for about 100,000 Idahoans. That's a lot. And if those credits expire, a 55-year-old earning about $63,000 a year in Idaho will see their annual premiums increase nearly $4,000. No one can afford that. Most Idaho families, that's just a huge change. They can't make up for that. And that's like paying the mortgage or the rent or their property taxes, heating bills, food, and money just keeping businesses afloat. And we're all hearing from people all over the state, parents who are delaying surgeries and retirees counting pills in between, prescriptions, young couples just trying to decide if they want to have a family. And what's often overlooked is that more than 1 in 4 farmers in Idaho and ranchers buy their health care on the exchange. And they don't have employer plans. They depend on these credits to protect their families and keep those operations running. And time's already tough for them, especially in the face of all these Trump tariffs. They don't need any more challenges than they have already. It is too much. This shutdown is hurting the very people who keep our state going. The folks who grow our food, who fight wildfires, teach our kids, and care for our neighbors. And on top of that, Republicans also cut Medicaid by $1 trillion in their budget, putting rural hospitals at risk of closure, according to our hospital association. And that is the lifeblood of Idaho, rural hospitals. They're already operating on the edge, and especially in communities like Salmon and McCall, Bonners Ferry. If they close, families are left driving hours to reach emergency care. And they're putting Idahoans' lives and their livelihoods at risk. Republicans in Congress, just like our own Mike Simpson, claim we cannot afford to extend these credits. And he stated in a recent interview, we've got to head this country in a different direction indeed. Instead of running our healthcare system into the ground and bankrupting hardworking Americans and Idahoans, we need to support working families and make the billionaires pay their fair share. If we're going to be the greatest country in the world, we need to support the backbone of our country, hardworking people. And without these tax credits, working Idahoans don't have a choice. It's either pay the rent or live homeless. Making these tax credits permanent would cost less than 1/10 of the price tag of the billionaire tax cut they passed earlier in the year. Less than 1/10. If Congress can afford to hand out massive tax breaks to billionaires, well, then they can certainly afford to help working families keep their heads above water. Democrats are ready to act to extend these credits and to prevent premiums from doubling, and to give Idaho families some certainty heading into the new year. It is so hard when you don't know where things are going to come. My message to Idaho's congressional delegation is simple. Represent the interests of hardworking families and Idahoans just trying to make ends meet. Stop protecting billionaires. Start protecting Idaho families from cutting these high costs. And the shutdown, and that is a job that we as Idahoans have elected you to do. Thank you, Senator, so much.
Thank you. And let's hear from Bob McMichael, who is facing this personally.
Thank you, Senator Murray, and thank you, Senator Wintrow. My name is Bob McMichael. I am a retired school teacher and professor, and I live in a rural town called Council, about 2 hours north of Boise on Highway 95. I retired about 3 years ago, so my wife and I are both retired. She worked in healthcare at St. Al's in Boise for 36 plus years. We are kind of not at all unique in that we are finally, though, one of those couples who are senior citizens on a fixed income. I never ever thought I would say that, but that's a fact for us now. Our annual income is about $42,000. That's some pensions, and my wife elected to take Social Security early. With the Social Security that she elected to take at age 62, that put us over the threshold to receive Medicaid for our health care. And so we last year chose a health plan on the exchange under the Affordable Care Act, and we qualified for the tax credits. And our tax credit was about $1,865. And our health plan this year, the premium was $1,916. So that left us to have to pay $51 a month for our coverage, which was pretty good. The plan wasn't very good, in my opinion. Very high deductibles, very high out-of-pocket max. But we're pretty healthy, and so we're just trying to stay fit and active, and we do a pretty good job of that. But last week I received a letter from the healthcare plan informing us that in January 2026, our health plan premium would increase by $367 to $2,232. So if the tax credits stayed the same, our monthly premium would have gone from 51 to 367. And that is almost unaffordable for us. It's going to really hurt. That's assuming the tax credits don't get taken away. If the tax credits do get taken away, the annual cost of the plan that we are on will be almost $27,000. So even if they keep the tax credits and they somehow get put back in, our increase in our premium is going to be almost 800% per month. 800%. That's 8 times. And so a lot of the reporting that I've seen saying that it might double just seems confusing to me. So I'm not an expert by any means, but it seems crazy that our Congress people who are supposed to represent their constituents in Idaho are completely tone deaf and ignoring this. It's so basically our option is even if they reinstate the tax credits, or if they are still on the table for us in 2026, it's going to be hard. But if they don't reinstate them, then we simply won't be able to afford any health care at all. So I have a back problem, and so we don't see the doctor for things like that. So we're both kind of trying to live with a little bit of pain because we're not sure how much things are going to cost when we go to the doctor. They don't tell you until after they've sent a bill. So that's our story. It's not unique, sadly, and it's pretty scary. I never ever thought I would see anything like what's going on right now.
Thank you. Thank you for sharing that. I really appreciate it. And we'll turn it over to Susan Wood for her story.
Thank you very much. And thank you so much for inviting me to this. It's so important to me. My name is Susan Wood, and I've lived in Boise since 1992, and I actually just retired in July. I was fortunate to be able to retire, and I spent the last 28 years actually in the insurance industry as a career. I specialized in long-term care insurance. I had an agency in that, and most recently in the last 15 years, I have worked on the Medicare side of things. My retirement came from 9 years of working for a private insurance exchange, one of the largest in the country. And so I actually worked with a lot of insurance companies all over the country. So I hear their stories as well and how difficult it is for them to plan when they don't know what's happening on the government side. And I see that happening now when, we can't get decisions made by our Congress and Senate, and they're just at a standoff, and it's hurting everybody. For me, when I retired, I had the option of going on a COBRA plan. That would have been $800 a month. I elected to go through the exchange, Your Health Idaho, and I was able to, based on my half a year income, I was able to receive a $580 tax credit, which brought my premium down to $72 a month. And as Bob mentioned, it's still a very high deductible that I'm not quite used to, $7,500 a year for a deductible when I'm used to something around $2,000 a year. And it's a significant maximum out of pocket. So if anything major did happen, I would have significant expenses through a very high out of pocket. I haven't received my letter yet to see what is happening with my health plan for 2026, but I did go on the exchange yesterday and was playing around, just keeping everything the same as this year as far as my income. It still showed that I would get the advanced tax credit, but my premium would actually go up by 175%, regardless. If I plugged in a higher income, which I'm actually not quite sure where my income will be for 2026, and I receive no tax credit if the enhanced tax credit goes away, then I'm looking at a 900% increase. And that's just based on my current plan if nothing changes with my current plan. And, the hard part is that, the insurance companies are still trying to file. We just don't know what everything is going to look like. It's a complete snowball effect. If, as it was said before, millions of people are going to fall off these health plans, and then the insurance companies are left with an unhealthy risk pool with high claims, and then they have to adjust their premiums, or they decide to leave the market, which is the other thing, which you really don't hear a lot being talked about, is the fact that the insurance companies will choose just to not participate, which I know is happening all over the country. It was happening. I knew about these things happening before I left my job because that was part of my job, was knowing what was going on in the future. And so this is just a crisis, and we are falling off of a cliff. It's an impossible situation that needs to be fixed for the long term. But the immediate solution is for our representatives to work together and approve the advanced tax credit so insurance companies can file and make their new plans with certainty. U.S. citizens can retain their health coverage at a reasonable premium, and we can move on with our lives. I mean, things are just going up exponentially. I almost lost my homeowner's insurance this year after being with a particular insurance company for 21 years, or actually longer. I think since I've been in Idaho, I've been with the same insurance company, but 21 years at my house with no claims. And my insurance premiums on my home have doubled, and they were going to drop me, and I fought it and they kept me, but I still think I'm being, paying way too much. But it's just terrible. Our whole situation of our country is in dire straits. I don't, I can go on and on, but I thank you so much for allowing us this time to share. And I'll send it back to Senator Murray. Thank you.
Thank you. Thank you, Bob and Susan, for sharing your personal stories. I know that's not always easy to do, but people need to understand that this is real and it's happening now. And that is why we are fighting so hard to bring our Republican colleagues to the table so we can negotiate a solution and extend these tax credits.
Great. We now have some time for questions from folks in the audience. If there are members of the media who'd like to ask a question, please use the raise hand function and we'll call on you. And when I call on you, if you can just say your name and outlet before answering your question, that would be great. We will start with Orion.
Thank you, Naomi, and thank you all for doing this. Orion Donovan Smith with the Spokesman Review. Senator Murray and Senator Wintrow, I'd like to hear from you both on this. We heard both Bob and Susan talk about their insurance plans from the marketplace being pretty bad or not very good, with high deductibles and out-of-pocket costs. Susan even mentioned that even with the same tax credit, her premium would go up this next year. Is extending federal subsidies for those plans the best way to address rising healthcare costs?
Well, there's certainly a number of challenges with our healthcare system right now. And the big, beautiful bill that the Republicans passed this summer really put a shovel into it because they did not extend these tax credits. So that is the immediate problem that we have in front of us right now. And if we can extend that, even though their costs are more than they were last year, there'll be a whole lot less if we can extend this tax credit. And the problem is if we don't do this fix right now, it's going to get even worse. In fact, much worse for absolutely everybody. People will not choose to buy their health insurance, and that means the risk pool gets smaller and there's uncompensated care, and everybody else's who not on the exchange, their costs are going to go up even more. And we will see an impact at our hospitals, to our providers, to families, and it's just going to get a whole lot worse. So we're focused on getting this done now, but we are also very concerned about what is also coming at us because what Republicans here did was change the Medicaid system dramatically, which means even more people in the future will lose their health care. I talk to rural hospitals like we have in Eastern Washington and Idaho all the time. They are desperate. They don't see how they're going to keep their doors open if they get this kind of uncompensated care added to all the other challenges they have through their doors beginning next January.
Yeah. I just would underscore what Senator Murray said about rural hospitals. I mean, rural Idaho, That's most of our state. And we risk closing about 25 rural hospitals, according to our Idaho Hospitals Association. And as Senator Murray said, with all the cuts to Medicaid that are coming, we in Idaho are already experiencing a 4% rate reduction by Medicaid right now because my colleagues have cut revenue so hard in this state that the governor has called for a 3% holdback on all agencies, and Medicaid is doing 4%. We already have a medical system teetering on the edge. We can't keep physicians. We have a crisis in that. We have these rate reimbursements that are cutting, and that's going to harm long-term care, people who are aging, home and community-based services. We're trying to keep people in their homes living independently, especially those with disabilities. I mean, the list goes on, and this is just one more, taking it on the chin to everyday Idahoans just trying to live their lives and make ends meet. We need to figure this out. And as Susan said, the uncertainty is debilitating. Everyone knows in business, you have to be able to plan ahead. And if you, as you're in your own family, can't plan ahead and you're living with this kind of anxiety and stress, it's only more debilitating to your health. So we have to figure this out.
And I will just add, what is really frustrating to me right now is Republican leaders are saying, we'll deal with this later. We will deal with this. You know what? This is a now problem to begin with, but later throws even more uncertainty into it. It's going to bring more chaos, and it isn't going to solve anything. So we're saying now. We need to get this solved now.
Thank you. I'll hold another question if there's time after others ask.
Great. We'll go to Joe, if you want to say your name and outlet.
Joe Paris at KTVB in Boise. For Senator Murray and Senator Wintrow, what advice do you have to Idahoans and Washingtonians that have similar stories to those that we heard today? I mean, do you advise people waiting to make healthcare decisions and hope that a deal is made? Or I guess what practical advice is there for people that are worried right now?
The best thing they can do right now is to let their members of Congress and their senators know their story. I have talked to a number of Republicans who just think this is not real, who haven't heard from people, who don't understand the reality of it in their own communities. So, boy, today, tomorrow, over the week, tell them your story. They need to understand this is real.
I agree with Senator Murray there wholeheartedly because I experienced that in the Idaho legislature, is that there are many things that people don't believe, even though the data or the facts are there. So they have to hear the personal stories and they have to hear from the people who voted for them. And like I said in my opening remarks, I was deeply troubled hearing U.S. Representative Mike Simpson say, we can't afford this because it's cost too much. And we need to send our country in a different direction. I mean, I couldn't believe that because the direction we're sending it is not a good one. And if we can afford, again, to make those kind of tax cuts to billionaires at the federal level and even in the state level, we could afford to help working families. That's all I heard about in the election from my Republican colleagues, is that we value working families, childcare, subs, everything. And I'm not seeing it. I want to see the rubber hit the road. I'm not seeing it right now.
Great. Next, we'll go to Bill.
Yeah, Bill Lucia with the Washington State Standard. Thanks so much for taking my question and for holding the event today. Senator Murray, I'm just wondering, I mean, obviously for folks dealing with these expiring tax credits and the potential for higher premiums, that's a tough situation to be in. But then the longer the shutdown goes on for, there are a lot of other, negative consequences with that, whether it's, federal workers not getting paid. I mean, we've covered the WIC program and, potential for funding running out there. I'm just wondering about how you're thinking about those trade-offs and, how far you're willing to push on some of these healthcare issues that, when it comes at the expense of the other negative consequences that come with the shutdown.
There's a really easy answer to this, and that is for the president and Thune and Johnson to pick up the phone and call the Republican leaders and say, let's figure this problem out so that people don't see these tax credits leave and have to pay huge prices and get the government open again. To me, they haven't, to this point, they have refused to even talk to Democratic leaders to solve this problem. And that to me is like, this isn't real. It is real. pick up the phone, call them, let's get this solved, and then no one will be hurt.
And now we'll go to Bo, if you can say your name and outlet.
Hi, Bo Erickson here with Reuters. Senator Murray, you just said that a lot of Republican senators aren't aware of this issue, but when we're talking to people in the halls up here, many of them do seem aware and they seem like wanting to address the issue, if not later. So are you not having any good talks, even if not formal negotiations with Senate Republicans on this? Or is there any hope that from you that they want to come to the table and solve this?
I think they are dug in on trying to say they want their clean CR, it's partisan CR, just pass this and then we can talk about this. But the fact is that who's going to trust that? And when is later? Is it like next March? That is not going to work. We have to keep our word to people in this country that we are going to make sure that these tax credits are extended. And we know darn good and well that if we just throw our hands up in the air and say, we'll trust you later, the chances of it happening are not there. So yeah, maybe they think in their caucus or wherever they talk to each other that we can, win this now and deal with it later, but that's not real for the people you just heard from. Bob and Susan are facing right now a decision in the next week about which plan to take or just to opt out altogether. That is multiplied by thousands and thousands and thousands of people and small business owners and farmers and everyone. So we want to work with them now to get a vote on this and to get it passed so that people are not hurt. That it's as simple as that.
I just quickly want to add, as Senator Murray was talking, I saw Bob nodding his head about the uncertainty of it all, and it's just not fair to the American people. It's not fair to Idahoans in my state. They need to plan. Look at them. They're nodding their head. This is harming people. This is hurting. And I want to thank you, Senator Murray, for standing up and doing the patriotic thing and fighting for the working class people and fighting for their health care. Because if you can't be healthy, you can't work. And you can't be productive and take care of your family. So thank you very much, Senator Murray.
Yeah, and I have to just say, a lot of people are beginning to really resent the fact that this last summer, Republicans worked really quickly to pass a tax cut for billionaires that was going to expire by the end of this year and extend that, but didn't take care of the general, average, small people, small business owners, families, community members, everybody that doesn't have billions of dollars, who can't afford it the least. So I think there's this disparity now that is really becoming real in our country, that we don't need a Congress that only takes care of the wealthy. We need a Congress that listens to real people. And that's what this issue is. Real people in their homes who are desperately trying to take care of their family. And the uncertainty right now is just crushing them. So I say to my Republican colleagues, wake up, come to their aid, work with us, get government open, and pass this tax credit.
Great. And we will go back to Orion for, it looks like, our last question.
All right. Well, thank you again. Senator Murray, I know this is, I'm going to sound a little bit like a broken record here. I understand you don't want to negotiate in public or in the press on this, and I understand that Republicans, at least publicly, are not coming to that table at this point. But I wonder what, for Americans that are reading our coverage or listening to our coverage, what they should think the way out of this is. Both sides so far are saying we're not going to budge. I hear, from Senator Wintrow that some of these Republican members of Congress need to hear from people who voted for them and have these concerns. Certainly some of those people exist, but we're in a very fragmented information environment, I think it's fair to say. How do you see your message breaking through and this playing out and eventually reaching a resolution?
Well, I think Republicans think that this is just going to go away. But I have to tell you, people are getting those letters in the mail. Idaho starting in just a few days, Washington State in a few weeks. Every state across the country, families are going to open up these letters. And what they don't want to turn around and go, what? My member who I voted for to represent me said no? I need help, and I need help now. So we have to keep the pressure up, and we're going to do that. We're going to stand up to a president who threatens us every time we turn around, and we're going to fight for the people, just those regular family members who are sitting in communities, small and large, all over our country, and say, we're fighting for you, and we're going to keep fighting till we get this done.
And I would just add, Senator Murray, thank you. And to me, what's telling is if the election were next month, I bet the actions would be different. And what I constantly feel is with the cuts, the $1 trillion cuts to Medicaid, oh, we're going to make this come to fruition after the next election. We're going to keep this far away because we know how decisions are made based on emotions right next to election. So that's very telling to me. I think if the election were to happen this month, there'd be a whole different response because people are suffering. And most of the people in Idaho are Republican. And it's really heartbreaking for me to see that my congressional delegation is not listening and they're turning their back on those folks.
Thank you.
Thanks, everyone. That is all the time we have. I'll turn it back to Senator Murray.
Well, thank you especially to Melissa and to Bob and Susan for sharing your stories. Your stories are overwhelmingly coming to us right now. And I just say to my Republican colleagues, stop just obfuscating. Stop pretending this isn't real. Pick up your phone, call the Democratic leaders, get in a room and solve this. That's what we're asking for. Thank you.